Hello, I'm Dr. Gary Theofilis of the ARILEX Center for Endometriosis and Pelvic Pain. Today we're going to discuss the pudendal nerve and pudendal neuralgia. The pudendal nerve is created by the formation of the sacral nerve roots S2, 3, and 4. They bind together to form one solid nerve branch that runs through the pelvis just adjacent to the ischial spine prior to entering what we call Alcock's canal. Upon exiting Alcock's canal, the nerve trifurcates. The bottom portion of the nerve innervates the perineum, which is the skin between the rectum and the vagina, or the rectum and the scrotum in a man, and also provides innervation to the rectum. The medial branch innervates the labia in a female, or scrotum in a man. However, in a female, the medial branch will also extend over and innervate the urethra of the sphincter. And oftentimes that we find that there are women diagnosed with interstitial cystitis that are actually misdiagnosed, and the actual problem is pudendal neuralgia and spasticity of the sphincter urethra. The upper branch of the pudendal nerve can innervate as high up as the clitoris or the external surface, the superior aspect of the labia, just inferior to the clitoris as well. There are many causes of pudendal neuralgia. So number one can be trauma, just trauma to the pelvis itself, a fracture of the pelvis. Number two can be pudendal nerve entrapment. So entrapment typically occurs in Alcock's canal, and there's various reasons of why that can occur. We often see this in athletes, people that are triathletes specifically, that are doing a lot of bicycle riding. We see it in patients that do spin classes, and the mechanism of action is as you're applying constant pressure to the ischial tuberosity, the ischial tuberosity bursa becomes inflamed and can inflame Alcock's canal. Now, a lot of times these patients will do very well with just a steroid injection and changes in their workout program. Other times, patients may have to go and have a surgical release of Alcock's canal to remove pressure from the pudendal nerve. That's very similar to the removal of pressure in carpal tunnel syndrome. We also have patients here at ARILEX Center for Endometriosis that have undergone mesh placement, whether it was for repair of a rectal prolapse or surgical repair of a vaginal prolapse. As the surgeon goes in and attaches the mesh to the inner wall of the pelvis, we have had and have seen incidents where the pudendal nerve becomes entrapped in the stitch. And this can be a very big problem. If it is not caught early, it's something that's very, very difficult to treat. We've tried various procedures such as a neurostimulation. We've tried pulse radiofrequency ablation and so on. In the end, we tend to find that these people do best with medication management. So that's pretty much it for today in pudendal neuralgia and the pudendal nerve distribution. Again, this is Dr. Gary Theofilis of the ARILEX Center for Endometriosis and Pelvic Pain. If you would like to find out more about us, you can go to our website, which is ARILEXmedical.com. Again, that's ARILEXmedical.com. But better yet, visit our Facebook page, which is the Center for Endometriosis and Pelvic Pain. On that website or on that Facebook page, you will find various patient reviews, and feel free to contact us. All our contact information is there. We're located just north of Atlanta. Telephone number is 706-265-6400. Thank you very much, and we look forward to providing you with more videos in the future.